The next question's from Catherine Fiancan Bakonga, pardon. Sorry, Catherine. Catherine, can you hear me?
Yes. Do you hear me?
Yes, please go ahead.
Okay. Good afternoon, Dr. Tedros, Mike and Maria. My question is relating the testing. As people and most of the countries are saying that conventional equipment is not available, does WHO advise them to turn to tech as an innovation, as South Korea is doing, by using interactive websites, apps that permits self-diagnosis, backtrack movements of infected persons? And for that, are you actively collaborating with ITU? If it's the case, could you please elaborate a bit on that? Thank you.
Yes, I would say this is probably the first epidemic of or pandemic of the 21st century in which the full power of information technology, social media, artificial intelligence is being applied to almost every aspect of this response, both in terms of risk communication with communities and targeting information, in avoiding misinformation and countering misinformation. And that's probably been one of the most powerful uses of information technology in this response. And we thank all of those agencies, both public and private, who have joined with us and with our partners to really enhance the way in which we can communicate the best information to people. Beyond that, there are a huge number of collaborations around surveillance applications, modeling, predictive modeling, analytics, in decision support tools, and many of these other applications. And Korea, China itself, and other countries have developed apps that have supported them in case detection, case reporting, case follow-up, tracking, tracing, and many other things. And we ourselves have deployed our GoData platform, which is a platform for contact tracing and follow-up and linking to lab results to over 50 countries now. And there are other IT applications like epidemic intelligence from open sources, which we use. We've built that over the last 5 years with a consortium of international partners, which tracks electronic information in multiple languages from all over the world using AI engines, and it allows us to stay one step ahead in terms of information around the virus and other epidemics around the world. We are working with the ITU. Our Chief Information Officer, Bernardo Mariano, is coordinating a huge partnership across the world with many institutions, including the ITU, to develop the best possible solutions. There is a tremendous amount of innovation, a huge amount of enthusiasm, but we need to turn that innovation and enthusiasm in a really structured way into products that work for frontline workers, that work for frontline systems. And that's what we're in the process of doing now. We do always have to have in the back of our minds, especially when it comes to collecting information on individual citizens or tracking their whereabouts or movements, that there are always very serious data protection, human rights and principles that are involved. And we're very, very cognizant of that. And we want to ensure that all products that are developed are done in the most sensitive way possible, and that we never step beyond the principles of individual freedoms, rights for individuals and for society. But yes, there are tremendous amount of collaborations ongoing. I could probably speak about this for a lot longer, and maybe Maria might want to speak about the modeling work and predictive analytics and other work that we're doing specifically. But again, I would just like to thank our partners from all over the world, and the power of innovation, the power of ideas. And we've had ideas for apps from people as young as 14 or 15, from individuals, from small startup companies, from huge globally based companies. It's been the most outstanding and most amazing outpouring of support and collaboration that I have seen in my career.
Just to add a couple of things, what we've seen, particularly in this pandemic, but we've seen in other epidemics, the use of telemedicine So many people who need care, who can't go to hospitals right now or can't go to their regular routine appointments, are utilizing telemedicine and having interactive chats and conversations with their doctors so that they continue to have care from the comfort of their home without having to go into a healthcare facility. And we're seeing the application of that across many different types of medicine. We're seeing innovative ways in which children and university students can continue their education, even though we have a large number of children and young adults who are out of school right now because of this pandemic. There's interactive ways in which they're continuing their education and learning through this pandemic, even if they're not physically in school. We see interactive ways in which technology is helping us do trainings. Where we can't do face-to-face trainings because we're not able to move around the globe, we're finding ways in which we can provide these materials either online through our Open WHO platform, where we have more than 500,000 people, up to 600,000 people who've enrolled in our courses in more than 24 languages. But we're also using technology to find more interactive ways to have one-on-one conversations with those frontline workers to answer and work through some of those very difficult questions that they may be having as they treat patients or care for patients or set up treatment units, et cetera. And we're also using technology in many different ways for these predictive analytics that Mike has mentioned. We work with a large number of modelers, you've heard me say this before, to work through scenarios, to work through predictions. But of course, these predictions are not realities. And so what is important is that we take all of these measures that we've been outlining from the start to make sure those predictions do not become realities. And lastly, technology and IT and apps have completely changed the way we think of social distancing. We're saying physical distancing now because we're actually talking about separating physically people, but keeping them socially connected. And we have ways in which we can do this now like we've never had before. So we keep people connected so that they feel that they're still part of this and we're all in this fight together, even while keeping them physically apart.